So first off, I think we'll kick off with Fiona. So Fiona, can you quickly run over what the topics we're going to discuss?
We're going to look at all the PPE equipment or safety precautions in terms of what you wear to safely open your clinic, both for you, the people who work with you, and even for patients.
And it's brilliant to have Jim on board, because Jim is involved in the business side of running a clinic and can talk to us and explain from a business perspective and a buying perspective the best way forward. So perhaps, Fiona, could we start off with masks, because they are very confusing.
Yeah, so people have got confused about masks and what the different types of masks offer. The first thing to realise is there is a differentiation between the medical masks and the FFPs, which are the face filtration protection. So first of all, medical masks, which I think we've got an example of, we can show you.
Yeah, so the medical masks are very simple surgical masks.
Yeah.
The FFP3, which Fiona talked about.
So Fiona, so a medical mask, Jim, do you mind holding a medical mask up there? So a medical mask is not FFP, it's just a medical mask. Which way do you wear it, Fiona, and what's it for?
So the medical mask, this is a type 2 medical mask, which means it's made of 3 layers. You wear it with the blue side facing out and the loops behind your ears. And what's important to realise is it does limit the spread of infection, but it doesn't necessarily protect the wearer. So when it's tested on expiration, meaning it does filter bacteria and perhaps viruses, but it hasn't been tested on inspiration. So this is the sort of mask that you might have your reception staff wearing, behind perhaps as well as screen or with eye protection. You might even consider, which I think is good practice, giving each patient as they arrive a face mask to wear whilst they're in your clinic.
Yeah, and as I understand it, Fiona, what happens is as you breathe out, the air is directed backwards. So instead of forwards, so if you do sneeze, the aerosol will not go as far and will be directed backwards. So it protects other people. There's debate about how much it protects you, because it's not really filtering all the little particles that perhaps can get to you.
That's right. And then it's also, I know there's some people querying, well, what does it mean if it says 2R? Well, R means it's repellent to fluid. So that just offers a 4th layer in the mask to make protection against splashes from blood or other bodily fluids. So technically 2R is possibly slightly more effective than a 2, but 2 with a face shield or a perspex screen would be completely adequate or offer the same protection.
So the R means resistant, water resistant.
Yeah, fluid resistant.
Okay. So
and they come in boxes of 50. So you get your box, and they've got 50 in there, and they're all ready to go.
Okay. And Fiona, who should be using those?
Well, I think patients should be given one as soon as they arrive in the clinic, so adding protection for everyone. Reception staff with additional protection as well, of either face goggles or visors or a perspex screen between them and the rest of reception.
Brilliant. What about the homemade masks, Fiona, that people are making? Do they offer any protection?
Well, again, there's thought that potentially they may limit the spread of infection, but in a less effective way than the surgical mask, because they're not composed of the same 3 filtering layers. So they may just stop the droplet spread of sneezes and coughs.
Brilliant. Now, can we get on to the FFPs, Jim? I know you've got a spreadsheet, you've got a chart, haven't you?
The FFPs are the European standard. People, when the lockdown first came, was asking, well, what are these KN95s or N95s? N95s are an American mask that were given approval by the World Health Authority as meeting the guidelines to protect against COVID. The Chinese equivalent was KN95, but in Europe our standard is termed FFP, which means filtering face piece. So FFP2 is equivalent to an N95 or KN95. So it helps protect, if it hasn't got a valve, it will help protect both the user of the mask and prevent transmission. If it has got a valve, it makes it more comfortable for the user, easier to breathe, but it doesn't perhaps offer the same protection at limiting transmission because there is a valve for expiration. FFP3 is simply even more effective at filtering and bacterial leakage prevention than FFP2. So FFP3 filters 99% of the virus and leaks perhaps only to 2% if there is a good seal around the face, and that's key. These masks are, where they're tested, they have to have a good seal on whoever's wearing them.
Yeah, brilliant. Fiona, could we just go to the top, Jim, and could Fiona just talk us through each of the types? So let's start off with, these are all different types of masks. FFP1, could you just run through them, Fiona?
Well, the FFP1 is going to offer similar protection to a surgical mask. It offers minimal filtration, doesn't protect the wearer, but may limit spread of the virus. So we haven't really seen lots of places advertising FFP1 compared to the others because they're the same as having a surgical mask.
Okay, let's do that. Yep.
FFP2, which is the same as the KN95 or N95 in terms of effectiveness, if it hasn't got a valve, which this first one shows, protects both the user and limits the spread of infection as long as the seal around the face is effective. This is the type of mask that in the JCCP guidelines they recommend for ideally for specific treatments.
And what treatments would they be, Fiona?
For our toxin treatments or filler treatments, that you would wear this plus adequate eye protection.
Yeah. So can you use the Chinese or the American equivalent, or has it got to be an FFP2?
You are not meant to advise people to wear ones that are not to European standards. So the European standard will have an EN 149 mark on it. But because of the shortage of PPE, again with the coronavirus, there was some discretion and leeway about people being able to wear the other types, the American and Chinese types of masks. But you've got to just be careful your source of masks and that they're genuine and going to be effective. But we should be recommending the European standard, which is these.
Okay. And what does the R and NR mean, Fiona?
That will be whether the mask is reusable or non-reusable, which most of them we've seen are NR, which means you can wear them for a single session.
What's a session, Fiona?
A session can be anything from 3 to 8 hours, as long as you remain within your clinical environment. So if you work for 2 hours and then go into a clean area without PPE for lunch, you would have to have a separate mask to wear after that. If your session lasted 4 hours and there was no damage or dampness to the mask, you could wear the mask for 4 hours.
Yeah. And are there any reusable ones, or are they all pretty much for one session only, Fiona?
So there are reusable ones, which is where if it has an R printed on it, it means you can reuse them. But most we are seeing, and I've seen sort of advertised, will be the NR, the non-reusable.
Okay. And the FFP3s, what's the difference between the filtration of FFP2 and FFP3, Fiona?
FFP3, if worn correctly, has a filtration of 99% and a leakage of 2%. FFP2, I think it's 94% filtration and up to 8% leakage. So FFP3 is simply even more effective, and these are the ones that are advised to wear for aerosol generating procedures, and in that situation ideally for a single use, so for one patient. I mean, that's the ideal and the gold standard. But
okay, so can you remind us about what an aerosol generating procedure is, Fiona?
Yeah, well, there's been some debate about this because generally aerosol generating procedures are going to be things like dental procedures where they're drilling or putting a filling in, surgical procedures under laparoscopy where you're pumping an abdomen full of air. So whether you can equate those to any aesthetic procedures is still debatable, but there are people, and certainly the JCCP guidelines suggest that we should consider lip filler or perioral treatments potentially as aerosol generating.
Okay, So let's just quickly look at the other ones. And there says disposable surgical mask and the disposable hygienic mask and then an industrial mask.
Yeah, so the surgical mask, we've gone through. The hygienic mask is simply almost just a thin layer of cardboard, really not offering much more than making your own cloth mask. And the industrial mask, it's just showing you because there are effective masks that are have a standard of approval that have been used by other industries, not medical, but would be as effective. So it's just to demonstrate that.
And these are ones used in industry for when people are protecting themselves against asbestos and things, aren't
Yeah,
they?
yeah.
Okay, so let's just run through some of the other things that people are going to need. So that's masks. So if we could just talk about some of the other equipment and then get into the practicalities of in the clinic who should wear what. So what should we do? Should we do gloves, aprons or clothing?
I think, well, it would be useful to have a look at the different, if we've got different visors available. I think Jim might have some examples.
The visors come in various shapes and forms. You've got visors that are made primarily for dentists, which are hard plastic, which go against the forehead, and you then put the visor on the front. The most important thing is to have them as anti-fog. If you don't have them anti-fog, they'll steam up and then they'll be useless. You can't use them. But the nice thing about these is because they're hard plastic, you can put them in something like the dishwasher and that will then take all the bacteria away so you can reuse them. And then there's the other face shield, fairly simple. You've got a little bit of elastic at the back, put it on and it's just straight there. So it all depends on what feels comfortable for you and whether you want to reuse them.
Yeah. Another option is these, Jim and Fiona. These are sort of masks that people wear in industry. Are these effective as well?
I mean, that would be effective, particularly if they provide a good seal around the eyes. But equally, I quite like the visors because they cover the full face. They're offering another layer of protection between your mask and the patient or who you're seeing. So it's personal preference, what you can work with, what you can see most clearly through, and what you can clean in between use as well.
But just explain why it is important you protect your eyes, Fiona.
Because we know from spread from respiratory droplets, you can contract the virus by that affecting either transmission to the mouth or to the eyes. So we shouldn't just cover the mouth and the nose, it should be the eyes as well. And
if you've got a mask, should you always wear, if you've got a mask, should you always wear some eye protection as well, do you think?
Yes, so that is again in the guidelines for practitioners and even I think for our reception staff, but in that situation some reception areas we've already seen are putting perspex screens for instance up so that the individual doesn't have to wear them.
So the options for eye protection are visors, are glasses any good?
Well, glasses don't offer much of a seal around the eye. So usually if you wear glasses, you should be looking at wearing perhaps a face shield as well.
Okay. Are there any other options for the eyes other than goggles and visors then?
No.
No. But there are some masks.
Face shields, obviously.
Yeah.
But there are some masks, aren't there, with a mask and a visor integral?
I haven't seen those, Adrian.
Yeah, well, they're the ones
some surgeons are wearing with a hood. Yeah.
Yes, when I was doing surgery, I used to have a mask, like a surgical mask with a visor as well. So that is another option as well.
Yeah.
Okay, so that's face protection. What are the other areas you're going to need to protect, Fiona?
So obviously gloves, as we do normally, we want to wear for every patient new gloves, so disposable gloves. Equally what we wear, we don't all wear uniforms. It might be we see that changing because ideally it is advised that we wear a specific uniform that we change into when we get to the clinic, change it out of before we leave, and it gets washed at 60 degrees to decontaminate before we wear it again. On top of that, you're going to look at wearing either disposable aprons, again, which can be changed for every patient, or disposable gowns, or some gowns, particularly if they're fluid resistant, can be worn for a session. But we would probably be looking at wearing a uniform with a disposable apron and our gloves.
Okay, any tips on gloves? Are all gloves the same, Fiona?
Well, for toxin, we don't tend to wear sterile gloves, but for filler treatments, even prior to COVID, we would advocate the use of wearing sterile gloves. So the usual gloves you wear in clinic are absolutely fine.
Yeah, and one thing I'd just like to say is, so gloves, you know, if you wear gloves to the supermarket or out, they're not actually very protective, because, you know, you could touch the virus on the gloves, and some people feel when in the ski resorts, gloves actually cause more problems because patients weren't, or people weren't washing their hands as much. So, and gloves are not, are gloves all completely unpermeable, Fiona?
No. So the gloves can be permeable, so they're not going to stop necessarily the virus coming onto your hands. So washing your hands between patients, certainly with the same patient, it would be okay to use an alcohol sanitizer on your hands, but between patients and frequently before and after taking off PPE, you need to be washing your hands for the 20 seconds they advise.
Okay, so let's just run through a little bit. So you're a practitioner, okay? How is it going to look for you? So you're a practitioner, you've got a patient coming in. Could you just talk them through the process for the patient and for you, what you're going to have to wear, how you're going to don and undon your clothes, and how you're going to wash your hands?
Goodness, that's quite a lot to talk about, isn't it? Well, the patient, first of all, I mean, the patient's going to arrive only at their appointment time. They may even have been told to wait in the car until their appointment time. They're going to be directed straight into a washroom to wash their hands straight away. They may have their temperature checked, which could be one of our triage points. They will have already been asked a number of questions to ensure that they're not currently infected. I know that, so screening questions only. They will be given in our clinic their own iPad that will have been cleaned to fill in consent forms. They will be sitting 2 meters away from anyone else. The reception area will be a clean area, so no one with PPE will go into that area. It will be behind a Perspex screen. The receptionist will direct the patient to the treatment room at the appointed time, where the practitioner will be waiting in PPE equipment. And that we explain to the patient so they don't feel overwhelmed or frightened by the fact they're going to meet their practitioner with a mask and a visor and an apron on, to explain it's for their protection as well as the practitioners.
And will the patient have a mask as well?
Yeah, so once they've washed their hands, they will be given a mask when the temperature is taken. So they're sitting in the waiting area. We're still maintaining social distance until they have their treatment, but they'll be wearing a mask.
Okay, and what will you be wearing?
I will be wearing a uniform that can be washed. I'll be wearing a disposable apron. I'll be wearing gloves with no other jewellery. I think that's important to note. So below elbows, we should wear only perhaps a wedding band, no watches or things that can interfere with washing. I'll be wearing a mask and I'll be wearing a visor.
Okay, and then you're going to obviously talk to your patient and consent them. And then
I will have already seen their consent on my own iPad, so they're not carrying an iPad into me. So I'll have read their medical history, their consent forms, so that minimal time is allowed in the room with me, because I know about them. I can query some of those questions. They will sit down straight on the couch, ideally not bringing personal possessions with them. So we've got minimal things that can be contaminated, and I would perform the treatment as I normally would.
And they'll be coming in on their own. They won't be coming in with company.
No.
So
when the patient goes into the treatment, we will be cleaning down the reception area.
Yeah. So absolutely. So the reception area will be cleaned thoroughly. And then after you've done your treatment, Fiona, the patient goes, yep. What happens then to you and the room? So what do you do? and what happens to the room?
Yeah, so we're lucky we've got air conditioning in our rooms, which means the air is recirculating. So ventilation is important. If you haven't got air conditioning, opening windows, you're going to need time for that to happen. You're going to clean any surface the patient has been on. You're going to obviously have got rid of sharps in the normal way, but also the PPE you were wearing in terms of apron, gloves need to come off, be binned in a clinical waste bin. I'm going to clean my visor, so we would use Clinicet because we know that will kill the virus. And I will have washed my hands before and after touching anything. So it's about cleaning everything, ventilating everything, and putting new apron, new gloves, clean visor for the next patient.
Okay, and can you explain what Clinicet is?
Have we got an example of Clinicet?
I don't know if we've got it here, actually.
I have, but I'll have to sit over there, but I'll have to stand up. You don't want me to stand up.
The Clinicet is an antimicrobial agent. So we were using it for cleaning pre-procedure for Botox and filler. It's sodium hypochlorite, which is known to be effective against the coronavirus. So because the coronavirus is encased in a lipid, a fat envelope, it is killed by 70% alcohol and other substances, including what is in Clinicet. So Clinell White, Clinicet, or alcohol at above 70% can be used for cleaning our visors and our surfaces.
Yeah, so that is important. So the virus, does not like, that's the reason for washing, isn't it? That its outer surface is disrupted because it's got a lipid surface. So any detergent will disrupt it. Is that correct, Fiona?
Yes, it is, Adrian.
Oh, great. Okay, that's good. So, I mean, that's a really interesting overview. Now we're going to ask Jim, how do people get all this equipment, Jim?
So all the equipment is, all of the PPE is available from all pharmacies. We also have an online shop which has the masks, surgical masks, the FFP3s, also has visors, Clinicet available. So they can come onto our website and then go onto the one online shop, or all pharmacies will have them. The problems we found before closing and you're finding now is that everybody wants to get hold of this equipment. So it's being limited. So, for example, you can buy 2 boxes of gloves, or you can buy 2 boxes of face masks, which is where if you need more, then it becomes quite complicated. So we've certainly got a lot of stock available, and you can get them from any pharmacy. And it depends on what they've got available to what you can purchase. But the price is obviously a lot higher than it was before the lockdown.
Yeah, absolutely. And any particular advice, Fiona, to anyone working, say, different scenarios, like a sole operator working from home and in a clinic, or everyone's got different setups. Any particular focused advice for them?
Well, I think whoever you are, you need to read the guidelines. There are lots of guidelines available. BACN for the nurses published a comprehensive list of guidelines, JCCP or BCAM, who I'm a member of. So have a look at the guidelines and familiarise yourself with what you need to make yourself and your patients safe. You then need to do a risk assessment on wherever you work to say, how do I make that environment fit these requirements, which may be more complicated if you work from home. It doesn't rule it out, but there's perhaps more things to consider. And can you then meet those requirements, which you'll need to do before you consider opening?
And are there any tips to how to do a risk assessment, Fiona?
Well, when I was in general practice, I used to find it useful to almost experience the patient journey. So enter the building as if you were the patient. You have in front of you the list of requirements from the start of that journey to the end, and you're looking as you enter and go through the process. Are you able to meet those requirements? So have I got posters and warnings on the door? Have I got tape set at 2 meters? Are my chairs 2 meters apart? So just running through the process in order, I think it can be helpful.
And looking at pinch points. So toilets are a pinch point, aren't they, Fiona?
Yeah. So corridors, toilets, how you you know, how you navigate between patients, what timings you're going to offer your patients, so we don't have too many people at once. You've got enough time for cleaning. So you've got to think of all these things, how you're going to prepare your patient, what you're going to tell them as they arrive. Are they going to stay in the car? How they're going to pay? Are they going to pay on the phone, or are they going to pay with card? So it gets more complicated the more people it involves. So for the people who work on their own, in some respects that is easier, because you don't have to think about the reception staff as well, or other people. So you've got to think of all the risks associated with everyone who's going to be there.
Yeah. And
we're lucky, we have 2 toilets. So in upstairs and downstairs, there's 2 toilets. So one of those toilets will be left with the door open, so they can be used as washing hand facilities, so no one has to touch the toilets. And that's the important thing, to try and keep the doors open so that people don't have to touch the doors many times.
Yeah. Yes. And Jim, I know you're planning a run through cosmetic courses, aren't you, imminently? Would you recommend a run through?
Yeah, absolutely.
Yeah.
So we're going to open up as a clinic on the 4th of July, but prior to that, myself and Fiona and the team are going to go in. We've got the shields already in place. We're going to make sure all the signs are up, and then we're going to run as if we're a clinic opening, just with the staff running through where to go, where they'll be, what we clean, when we clean them, and make sure everybody is 100% sure about what to do before we open and start treating patients.
Brilliant. Guys, is there anything else you'd like to add for advice for people? Fiona, Jim?
No, I think we've covered quite a lot.
And everything's available on cosmeticcourses.co.uk. So if you want to see, if you want to get things from the shop, or you want more advice, then if you look on the blogs on there, there'll be lots of videos and information to be able to see.
Yeah, and we've during this period we maintained our helpline. So if you have got any queries, please ring us, and we'll be able to put you in contact with the appropriate advice to help you start your clinic. So thank you all very much for watching. Thank you to Fiona and thank you to Jim for clarifying particularly the mask issue, which now to me is much clearer. So appreciate that.